Now, are there different types of strokes?
There are different types of strokes. There are strokes where you don't get enough blood flow to your brain. We call them ischemic strokes. Or there are strokes where a blood vessel in your head, inside your head or outside your head, ruptures, called a hemorrhagic stroke.
Wow, it sounds like that second one, the hemorrhagic stroke, would be worse. Is either one worse than another?
They're both bad for different reasons. I wouldn't want to pick either one of them, to be honest with you.
Yeah, so they both can be devastating.
Both can be devastating.
What are the symptoms that somebody has when they first have a stroke, and little minor symptoms? Are there ever minor symptoms?
There are minor symptoms. It's typically a sudden loss of function, and sometimes that can be a sudden loss of vision, which in and of itself may not be particularly major or worrisome on the outset, but can lead to other problems. Blind or losing vision in one part of your eye. Sometimes you just notice your arm feels a little bit numb, or your whole side of your body feels a little bit numb. Not something that would make you go to the hospital right now, but probably should, because it's a concerning thing that something worse may happen.
So visual changes, eye changes, it can be a little bit of the vision that's changed, or weakness in an extremity. How about speech?
Speech can be a problem. Sometimes speech getting slurred, or even hard time understanding or producing speech. So maybe miss some words or make some mistakes when talking.
Why is it important that we recognize these symptoms early? If I was talking to you or sort of started having slurred speech and you said, "Oh goodness, Dr. Bob is ready to have a stroke," why would it be important for you to recognize it quickly?
It's very important because the treatments that we have to help stop problems from stroke, to make people better, are very time dependent. There's a clot busting medication called TPA we can give people who have the strokes, called the ischemic strokes, that may help decrease their disability or their problems from the stroke down the line, and sometimes can make people better in the long term.
So if anybody has any symptoms of a stroke at any time, you give them TPA, or you got to figure out what kind of stroke it is?
You got to figure out what kind of stroke it is first.
So if it's a hemorrhagic stroke, that might cause some problems, a clot buster, because it would keep everything from clotting back.
Correct.
So how do you tell the difference?
The first way to tell the difference, the easiest way, is to get a CAT scan or a CT scan of the head. What that is it's a fancy X-ray of your brain, and on that X-ray, blood shows up really bright. And typically, if you've had an ischemic stroke, or a stroke with no blood flow in your brain, your CT scan looks normal. If you've had a hemorrhagic stroke, you're going to see a lot of really dark, high density blood or brightness on the head CT that tells you not to give TPA.
What is the time element? If I'm not with you, the doctor, if I'm at home and somebody realizes that and I call 911, how much time do I have to get the TPA?
That's a good question. It used to be up to 3 hours, but they've recently looked at the guidelines and looked at how people have done with the TPA medication and found they could extend the window up to 4.5 hours.
But if I got there in 90 minutes, it'd be better than 3 hours.
Correct. 90 minutes is better than 3 hours. There's an old phrase they used to use called "time is brain," and I think they used to use it for heart attacks too, which was time was heart, but they also use time is brain now for stroke treatments.
And that means the quicker you get that blood supply back to the brain, the better you're going to recover.
That's correct. Or that's the assumption.
And that's what we hope is
going to happen.